Hello, my name is Catherine Gallagher. I'm the diabetes specialist dietitian that covers the antenatal service at Whiston Hospital. I'm going to talk to you today a little bit about the benefits of breastfeeding, particularly if you've had diabetes. Breastfeeding rates in the UK are among the lowest in the world, which in my opinion just reflects that as a society, we're not supporting women in the way we should be to encourage them to breastfeed. The purpose of this video is to equip you with the facts regarding breastfeeding and to let you know what support is available to you and your family locally and nationally, whether you choose to breastfeed or not. I want to make sure that women are making an informed decision because breastfeeding isn't easy, but at least if you have that information prior to delivery, it gives you that time to think whether it is for you or it's not. I hope you enjoy. Both breast milk and infant formula milk contain the basic nutritional building blocks such as water, protein, carbohydrates, fats, vitamins and minerals. However, there are significant differences. Manufacturers of infant formula make their products sound like the closest substitute to breast milk, and they spend lots of time and money in their efforts. However, it is so important to remember that breast milk also contains lots of additional factors that are not found in infant formula milk. We will come on to these in a few moments. Let's focus for a few moments on breast milk itself. So you'll see on the screen that there's lots of words that you may or may not have come across before. These words are classed as immunoglobulins. Nearly didn't get it there. These offer protection against pathogens that maybe mum's encountered in the past or in her present environment. So they include things like transfer factors. These assist with the absorption of nutrients and protect against bacteria. Nucleotides are important metabolic regulators, so basically meaning they protect tissue and allow it to repair. Anti-inflammatory molecules, so these dampen down any inflammation in baby's gut, lungs and brain. We've got hormones there, which again trigger baby's immune system, supporting the growth and development of the gut. Bifidus factor and, well, I'll try and give this one a go, oligosaccharides. These work to create an acidic environment, inhibiting again the growth of bacteria. They also increase something called gut peristalsis, which will help to increase the frequency of stooling, and again that can be quite beneficial for preventing things like jaundice. We can also see on the screen here we've got things like enzymes which improve digestion of fats and sugar, so help to break down any harmful bacteria. Your white cells, these again engulf harmful bacteria. Viral fragments, they trigger the baby's immune system into action. So I think I've covered all of them there. You don't need to remember these kind of fancy names. I just thought it might be worth kind of going through this just to kind of highlight that there's a lot in breast milk that isn't in formula milk that actually is really helping baby's immune system to grow and develop. In addition to that, I just want to mention that breast milk tends to be higher in something called a whey-based protein, which tends to be easier for baby to digest, so again keeping the gut nice and healthy and protecting against bacteria. Whereas, and I think, to be fair, I didn't really know this until quite recently, was that cow's milk protein, which is found in your infant-based formulas, can increase the risk of juvenile onset diabetes, particularly in families that are at risk of diabetes. So it's definitely noteworthy. Did you know that human babies are less mature than any other mammals when they are born? The composition of human milk or breast milk contains a range of different substances, which we've just discussed, that will support the immature baby until his or her own systems are able to take over and other foods can be introduced. This breastfeeding helps to reduce the risk of things like chest infections, gastroenteritis, which is kind of upset tummies, ear infections, urinary tract infections, diabetes, which is really important for us to think about, and also some allergies. So it's important to add whether you have had type 1 diabetes, type 2 diabetes, or gestational diabetes throughout pregnancy. Breastfeeding really has lots of benefits for the baby. So firstly, it can stabilise the blood sugars following delivery, which again reduces the risk of neonatal admissions. Exclusive breastfeeding, which is breastfeeding for up to greater than 6 months, or a kind of delayed onset of introducing infant formula, can really reduce the risk of childhood onset diabetes. Particularly as we know we've had diabetes, so baby is at higher risk than the general population. It can also reduce the risk of obesity or type 2 diabetes in the baby later on in life. So an array of really positive benefits there for baby if it is possible. So as well as that, there's lots of benefits for mum too. So again, can help stabilise blood sugars following delivery, reduce her risk of later developing things like breast cancer and ovarian cancer, helps to build that connection with the baby as well. So once baby's born, I'm sure you just want to be as close to baby as possible. And it also can help with kind of helping to lose a little bit of weight after baby's born, and helping your body weight to return to what it previously was prior to pregnancy. This is probably a good time to also mention, when we're focusing a little bit more on you, mum, is that when you have diabetes and you're breastfeeding, particularly if you're someone who has on insulin, so maybe a lady with type 1 or a lady with type 2 on insulin, you can be at higher risk of hypos throughout the period of breastfeeding. So it's really important to consider extra snacks, have a chat with your diabetes team regarding reducing your insulin doses, and that's really normal. So it's important just to note that now, when you are having to think about whether you're going to breastfeed, it's kind of good to have those conversations prior to delivery if possible. And your diabetes team will be more than happy, as will your midwives, to kind of have a chat about that. Mum starts to produce colostrum, which is sometimes referred to as early milk, while pregnant. The special milk is a yellow-orange colour, and it's packed with those antibodies or bacteria-fighting properties. It's only required in really small amounts to provide the benefit to baby. So even if it's sort of within the first 48 hours after birth that you do manage to breastfeed, you can rest assured that baby has got a lot of those antibodies and protective properties from that the early days of that breast milk. It's designed to support transition from the intra to extra uterine life, so when baby is now delivered into the world. As we said, it's only required in very small amounts. Also worth noting that being able to express colostrum is a really useful skill. As we know, breast milk is a complete and a perfect food for the baby, but if the unexpected does happen and you and baby are separated, or if the baby has any feeding difficulties or health problems, it can be easier to express your milk for the baby if you have practiced beforehand. So have a chat with your midwife regarding that. So your breasts do start to produce colostrum about 16 weeks of pregnancy, sometimes as early as 28 weeks of pregnancy. Some women find that they do leak colostrum from their breasts. Do not worry if you do leak colostrum, it's not an indication that you're not able to breastfeed. The amount of colostrum does vary from woman to woman. Sometimes it's a few drops, to as much as a teaspoon. So a good time to start expressing colostrum would be when you reach about 37 weeks of pregnancy. If you're having an elective cesarean section, we normally advise expressing only within the 24 hours before your operation, as there is a small risk that it might induce your labour. You can express colostrum as often as you like, and a good time to have a first practice is when you're probably in the bath or the shower. You can express colostrum prior to delivery, which we know, and again, speak to your team at Whiston, speak to the infant feeding team and the midwives as they are there to support. I'm going to turn on my camera just to show you the different packs that we have available now. Sorry, I'm not able to turn on my camera just yet as I realise that I block out the content of this slide, so I will add a picture of those packs at the very end of the presentation. So first of all, I'm definitely no expert when we're talking about babies' urine and stool outputs, but I did think that this was something that might be useful, particularly maybe for new moms who are unsure sort of the smell, the colour, the frequency of urine and stool outputs. So I did think this was quite an interesting slide to include. This has come from the Baby Friendly Initiative website by UNICEF, so definitely have a look on there. The links are at the back. Lots of really great videos and resources on there. Kind of tying into colostrum, I wanted to kind of just draw your attention to the day 1 to 2 under stools. So it says 1 or more in 24 hours, dark green, black, tar-like colour called something called meconium. So colostrum also has a little bit of a laxative effect, so it helps with the passage of meconium, which again can help to prevent excessive jaundice. So just something that I thought was noteworthy there. Again, I can't stress enough how important it is to have a chat with the midwife, the infant feeding team. They're already skilled and equipped to have these conversations in more detail. So definitely, if you're confused or you're unsure, call your midwife, call the infant feeding team, let your diabetes team know. We can direct you to the right people, and there is support out there. Okay, so again, I've just added this more so for reference. I'm not going to go into it in detail. You can have a little read yourself, but it just kind of gives a little bit of reassurance around sort of what is normal for most babies. Again, it's so individual. So if you are worried or you're concerned or it's not really following the path outlined in this diagram, I would just have a chat with your midwife, as they'll be able to give you a little bit extra information and support. In particular, I would stress have that conversation with them before you decide that breastfeeding is not for you. If you are worried, but you are keen to breastfeed, have those conversations, get that information and that help that you need. Okay, moving on, we're going to have a little chat about hypoglycemia. So first of all, most babies have no difficulty in adapting to life outside the womb. However, some babies, they do have an increased risk of developing low blood sugars, also known as hypoglycemia, but these babies will be carefully monitored for a longer period. Babies with an increased chance of low blood sugars can include early or premature babies, babies whose mom have diabetes during pregnancy, which is the purpose of today's slide, babies who are maybe ill or who needed help to breathe when they're born, babies who are lighter in weight than expected for the number of weeks of pregnancy, so something we refer to as small for gestational age, babies whose mothers maybe have been on medication for blood pressure, beta blockers, or babies who have a family history of certain metabolic disorders. It's important that your baby is breastfed as early as possible, and that we continue with those breastfeeds every 3 hours if safe to do so. It's important in helping to prevent low blood sugars in the baby. And there are leaflets again from FMAU protecting your baby from low blood sugar that can provide some further advice. Also, just again linking in with colostrum, the express colostrum, it can be given to the baby after breastfeeds, and the baby is going to be carefully monitored, and the team will definitely check their blood sugars quite regularly. We know that skin-to-skin contact, something we'll come on to later on, it really does help with building that relationship between mum and baby, but also keeping baby warm and helping with stabilising blood sugars. There may be occasions where it is recommended that we do need to supplement with infant formula, in terms of nationally, they say it's recommended when blood sugars are below 2 and breastfeeding or expressing is not successful or has been insufficient to increase the blood sugars to an acceptable level. Again, the team will be keeping a close eye, monitoring and checking. If you do need to supplement with infant formula, it doesn't mean to say that you can't breastfeed after that. When baby's blood sugars return to normal. In the first year, we would always recommend something called a stage 1 or a first milk as the best option if baby does need to receive that infant formula. And we'll have a little chat later on about those infant formulas before we finish up today. Okay, before we finish up today, I just want to talk a little bit briefly about infant formulas. And I'm not trying to slate infant formulas by any means. I'm just trying to give you that information to let you know that no infant formula is closest to breast milk. Because hopefully by now we'll appreciate that it is impossible to replicate those hundreds of components that is made up of breast milk. To comply with EU regulations and requirements, all infant formulas have to have a similar nutritional composition in terms of that carbohydrate, fat, protein, water. However, we know that those antibodies are not found in your infant formula. Marketing claims often they run a little bit on our emotions, and they give these health-giving properties of the ability of some of these milks to control baby's behaviour, whether it be to help provide extra hunger, extra sleep, to support with reflux. And actually a lot of these milks, there's no evidence behind these claims and they're unnecessary. So it's not something we really need to go into, but just to let you know that there is something that the WHO, the World Health Organization, created in 1981 called the International Code of Marketing of Breast Milk Substitutes. So basically they set out sort of guidelines that companies did and did not have to follow. So for example, they have said that they can't make claims that they're superior to breast milk. However, a lot of the law around marketing these milks, under 6 months in the UK, the code is followed, but beyond 6 months, there's no real laws. So you will see that the first milk that's offered is going to be sort of a stage 1. As I said, I think in the previous slide, stage 1 or first year or first milk. And you won't see any milks for babies under 6 months that are any different to that. But then we move across the 6 month and we start to see these hungrier baby milks, these anti-reflux milks, and actually there's no evidence behind them. The infant feeding industry is the 11th largest in the world, and it's worth a lot of money. So I think that is why a lot of these, as I said, they play on our emotions. I'm just going to take one as an example. The tables here, again, it's from the Baby Friendly Initiative website, and have a little look into them yourself in more detail if it's of interest. But it does kind of, just as an example, hungrier baby milk, so it's actually higher ratio of casein to whey protein, which makes it harder for baby to digest. So actually it's not going to be beneficial there in terms of making baby any more fuller from its food. It might actually cause more issues with constipation than anything. So yeah, just be really careful if you choose to use infant formula, or you need to use infant formula at whatever point of your breastfeeding journey. I would just recommend go for your first stage or your first milk or your first year, particularly up to 12 months, and just try to ignore all these other products that are available. Often they're a lot more expensive and they are playing on our emotions. So I'm not going to go off on a tangent about this. The information's there. It's just something I want to make sure that people are mindful of and aware of, and that they don't feel that they have to pay double the amount for a milk to provide the best for baby. Okay, because it's definitely not the case. So breast milk first if possible, but if you are deciding to follow an infant formula milk, just go for your first year, your first milk, your stage 1, and try and kind of get the blinkers on all the others that are out there. If baby is struggling in any way, or you're having any problems with the feeding or with hunger or reflux or whatever it might be, have a chat with the health visitor or the midwives. Okay, thank you all for listening. I hope I did not waffle too much. I just wanted to turn on my video quickly just to show you some of the resources that are available to you at FMAU in the antenatal outpatient setting. So this is just a little bit of information on breastfeeding in hand, expressing your colostrum. We've got lots of packs that are available to you, so your syringes. Again, the infant feeding team, the midwives will be able to support with hand expressing prior to that, and we know that if you're having a C-section, to make sure that that's done within the 24 hours before. But yes, these packs and leaflets are all available at FMAU or from the infant feeding team. I also just popped on some useful links and resources there. The baby friendly initiative is probably where a lot of my stuff has come from today, so definitely check out their website or the breastfeeding network. The infant feeding team at Whiston Hospital, the numbers there. If you're listening to this around the time of the pandemic, things are constantly changing about what's offered. We used to offer groups. I think they're kind of suspended at the moment, but you can still get that individual face-to-face support from the infant feeding team. And then we've got the National Breastfeeding helpline as well. So I hope that this has helped you, whether you decide to breastfeed or you don't. I hope that we've equipped you with the information and a little bit of insight into the benefits. And I've got another presentation I'm going to show just a little bit around attachment and positioning. So if you're keen to breastfeed but you're struggling, definitely check that one out as well. And any problems or questions, please get in touch with us. That's what we're here for. Thank you. I hope you enjoyed.